Good evening, everybody. Today we are going to do pathology. So let us begin with the first question. Most common site of brain metastasis is A. Brainstem, B. Cerebellum, C. Cerebral cortex, D. Thalamus. Now, what happens? These metastatic brain tumors are most common tumors of brain. The distribution of metastasis in brain is directly related to the amount of blood flow to each part of the brain. 80% of brain metastasis occurs in the cerebral hemispheres, mainly in the frontal lobe. 15% occur in the cerebellum and 5% occur in the brainstem. The most common primary sites are lung 50%, breast cancer 15 to 20%, unknown primary cancer 10 to 15%, and melanoma 10%. Colon cancer 5%. Metastases to brain are multiple in more than 70% of cases, but solitary metastases do occur. Dural metastasis may constitute as much as 9% of total CNS metastasis. So the correct option here is cerebral cortex. So cerebral cortex, about 80% occur in the cerebral hemispheres, followed by cerebellum, and then followed by brainstem. About 5% occur in the brainstem. And which tumors commonly metastasize to brain? It is a lung cancer, followed by breast cancer, 15 to 20%. Unknown primary cancers, melanoma 10%, and colon cancer 5%. Let us move to the next question. Which of the following is inherited as autosomal recessive form? A. Sickle cell disease. B. Hemophilia. C. Hereditary spherocytosis. D. Glucose 6 phosphate deficiency. Now, glucose 6 phosphate deficiency and hemophilia are X-linked recessive. And hereditary spherocytosis is autosomal dominant. The only sickle cell anemia is autosomal recessive. Autosomal recessive form. So the correct option here is sickle cell anemia. Remember, hemophilia and G6PD deficiency are X-linked recessive. Hereditary spherocytosis is autosomal dominant, and sickle cell anemia is autosomal recessive. Let us move to the next question. Anti-transglutaminase antibody is seen in anti-transglutaminase antibody is seen in A. Celiac disease, B. SLE, systemic lupus erythematosus, C. Collagenous colitis, D. Tropical sprue. This anti-transglutaminase antibody is seen in celiac disease. Celiac disease. Now, asymptomatic celiac disease with selective malabsorption is being found with increased frequency, and diagnosis can be made by testing for anti-gliadin, anti-endomysial, or transglutaminase antibody, but may also require endoscopic biopsy. A trial of a gluten-free diet can be confirmatory. So the anti-transglutaminase antibody is seen in celiac disease. Shock lung is characterized by A. Alveolar proteinosis, B. Bronchiolitis obliterans, C. Diffuse pulmonary hemorrhage, D. Diffuse alveolar damage. This shock lung is characterized by diffuse alveolar damage. What is shock lung? It is acute respiratory distress syndrome. It is also called diffuse alveolar damage. It is acute alveolar injury and acute lung injury. So shock lung is equal to ARDS, which is equal to diffuse alveolar damage, which is equal to acute alveolar injury. It is equal to acute lung injury. What happens in shock lung? The lungs are heavy, firm, red and boggy. The lungs are heavy and firm, red and boggy, and exhibit a congestion. Interstitial and intra-alveolar edema is present in shock lung. Inflammation and fibrin deposition is seen. The alveolar wall become lined with waxy hyaline membranes that are morphologically similar to those seen in hyaline membrane disease of neonate. So the shock lung is characterized by diffuse alveolar damage. Demyelination is the major feature of multiple sclerosis. Which of the following cells form myelin in the central nervous system? A. Astrocyte. B. Ependymal cell. C. Microglia. D. Oligodendrocytes. Now what happens? The myelin sheath is formed by oligodendrocytes in the CNS and by the Schwann cells in the peripheral nervous system. The gaps formed between myelin sheath cells along the axons are called as nodes of Ranvier. Since the lipid structure of myelin cells is a good insulator, the myelin sheath increases the rate of propagation and efficacy of transmission of impulse along the axons. The electrical impulse jumps from one node to next at the rate of as fast as 120 meter per second. This rapid type of conduction is known as saltatory conduction. Demyelination can occur early in life as a consequence of congenital metabolic disorders, and demyelination later in life can be repaired with glia, which explains the frequent exacerbation and remissions in multiple sclerosis. It is believed that in multiple sclerosis, multiple mechanisms immune injury of myelin, that is, cytokine mediated injury of oligodendrocyte and myelin, digestion of surface myelin antigen by macrophages, complement mediated injury, and direct injury of CD4 plus and CD8 plus cells. This type of injury causes the loss of saltatory conduction in the nerve fibers. The exposed axon is susceptible to further injury, resulting in irreversible axon damage. So the correct answer here is oligodendrocytes. Renal angiomyolipoma is associated with A. Tuberous sclerosis, B. Neurofibromatosis type 1, C. Neurofibromatosis type 2, D. All of the above. Renal angiomyolipoma. Now, angiomyolipoma are present in 25 to 50% of patients with tuberous sclerosis. And this tuberous sclerosis is a disease caused by loss of function mutation in the TSC1 or TSC2 tumor suppressor gene. This is a benign tumor consisting of vessels, smooth muscles, and fat. It is characterized by lesions of cerebral cortex that produce epilepsy and mental retardation, a variety of skin abnormalities, and unusual benign tumor at other sites such as the heart. So the correct option here is A, tuberous sclerosis. HER2 new gene causes breast carcinoma due to A. Overexpression, B. Suppression, C. Mutation, D. Translocation. HER2 new gene causes breast carcinoma due to overexpression. Now, what happens? This HER2 new or HERB2 gene, which encodes for the receptor tyrosine protein kinase HERB2, also known as CD340. Amplification or overexpression of oncogene has been shown to play an important role in development and progression of certain aggressive types of breast cancer. It is translocation. Activation of which gene leads to bladder carcinoma? It is P53. Gene associated with superficial papillary urothelial neoplasm is A, P53, P16, P7 KRAS. It is P16. Reversible change from one cell type to another is known as metaplasia. Cells seen in cutaneous T-cell lymphoma are called as A. Councilman bodies, B. Barr bodies, C. Sézary cells, D. Dolly bodies. They are known as Sézary cells. Pancreas tumor is A. Superior cell tumor, B. Inferior cell tumor, C. Median cell tumor, D. None of the above. Histological picture of a lesion excised from right cervical region is shown below. What is your diagnosis? What do you think it is? A. Necrotizing granulomatous inflammation. B. Neurofibroma. C. Schwannoma, D. Hodgkin lymphoma. It is necrotizing granulomatous inflammation. Which one of the following likely diagnosed based on smear? What you see here? A. Acute myelogenous leukemia. B. Acute lymphoblastic leukemia. C. Hairy cell leukemia. And D. Chronic lymphocytic leukemia. Well, the peripheral smear, you can see myeloblasts having delicate nuclear chromatin, 2 to 4 nucleoli, moderate cytoplasm. One of them also shows R rods. So this is a case of acute myelogenous leukemia. So the correct option here is A. The most important investigation in the given case to diagnose if the condition is a neoplasm. A. JAK2. B. Erythropoietin level. C. PaO2. D. Bone marrow aspiration biopsy. Here you can see the platelet count is much increased. So it is essential thrombocythemia. This can be detected by JAK2 mutation. Correct answer is JAK2. Sterile non-destructive vegetation present on mitral valve. It is non-bacterial thrombotic endocarditis. The given biopsy from the intestine suggests A. Squamous cell carcinoma, B. Adenocarcinoma, C. Adenoma, D. Colorectal carcinoma. This is a adenoma. SS18 SSX1 gene is associated with A. Liposarcoma, B. Rhabdomyosarcoma, C. Synovial sarcoma, D. Ewing sarcoma. What do you think is the correct answer? Question 18. SS18 SSX1 gene. Well, it is a synovial sarcoma. WAGR syndrome includes all Wilms tumor, aniridia, growth retardation, D mental retardation. Don't get confused. It is genitourinary abnormalities are present G for. Here they have given growth retardation, so that is not there.